While we're extremely excited about the grand opening of the new resource center, there are so many incredible things going on here in Liliha. Joining me now to talk more about this, Jerry Correa, CEO and President of St. Francis Healthcare System of Hawaii. It's great to see you, Jerry.
Nice seeing you, Lisa.
You know, with Hawaii's aging population, many folks finding themselves having to take care of a loved one and having some of those needs met are kind of difficult. Can you tell us what St. Francis is doing and the vision for the Kupuna Village here?
Sure. This has been a vision that's been going on for 5 years now. Started out with the hospitals returning back to St. Francis, and the new vision of the campus focusing on seniors, focusing on senior services. We wanted to build a skilled nursing facility, an assisted living facility, and geriatric services throughout the campus. So we started focusing on that and focusing all the other geriatric type services that are needed. We realized as we were moving forward with that vision that we couldn't do it alone. We needed to have partners. Partners like the Parkinsons Association, partners like Hawaii Pacific Neuroscience and so forth, to fulfill the vision. And as we were going down this journey and putting all the pieces together in the Kupuna Village, we discovered that the caregiver population was being very stressed also. Our caregivers that are taking care of their parents, taking care of their loved ones, we saw that. And so we started embarking on probably 70% services for seniors and maybe 30% services for caregivers. So as we were designing the campus, yes, we have a skilled nursing facility. Yes, we have an assisted living, but there's a beautiful courtyard outside. And how do we design that? How do we create areas in the courtyard where we can have caregiver support groups, such as the Parkinsons Association? We can have areas that they can use. We wanted a place where some of these support groups could call home. 5 years ago, when we were designing the courtyard, I was asked by the engineers, by the architects and construction, how do you want the courtyard? And I remember walking with the architect and construction individuals, and I said, my wife and I just came back from the canonization of St. Mary Ann in 2012. And when we were there in St. Peter's Square, I was looking around and I was in awe. And so the way I'd like the courtyard to be designed is to get that same feeling. And the feeling was the Franciscan feeling. I want the sisters, the Franciscan sisters, to come in here and feel that there's a Franciscan presence. And what I was asked was, what the heck does that mean? And I said, there's a feeling of, in the Franciscan world, putting somebody before yourself. The sisters aren't over the top, so the courtyard can't look over the top. We really want the courtyard to be first class for the middle class. And that's kind of our mission, is to take care and go where the unmet need is. To create healthy communities, but really being Franciscan is putting others before yourself. So I wanted this to have a special feel, and I said, there's statues in St. Peter's Square, and I remember standing there and I was in awe. And the engineer said, "You want us to put statues on the top?" And I said, "No, I just want that feeling, And they go, "What is that?" So it was hard to articulate that. There's a calmness outside. There's a good feeling. There's a water feature that's flowing. And there's a bench that you can sit down next to the statue of St. Mary Ann. And there's many people that go there daily and sit and talk story. That's a good feeling. There's pavilions that are set up so that some of the support groups can have some quiet time. So that's what we try to do here, is to try to create something that has a good feel. And then sometimes I refer to it as a Franciscan feel, and yet there's an awe about the place. one of our big partners, Hawaii Pacific Neuroscience, introduced me to Jerry Boster at the Parkinsons Association, and Jerry and I, we have the same DNA when it comes to helping people, when it comes to helping the community. And as we fulfill the campus, I look for partners like that. And so we've got pavilions outside where support groups can gather, where meetings can take place. We have an education center where we can have education for caregivers, as well as seniors for active aging. How do we teach our caregivers and our seniors about the tools that they need to take care of their loved ones so they can stay out of the hospital? We designed a kitchen, a demonstration kitchen for caregivers and seniors so they can engage in cooking healthy foods for their loved ones or themselves. And we're engaging with the community to bring in experts in various fields so that education can take place. One of the partnerships we have with Jerry Boster is to in turn use the facility and teach and educate the community. So I'm really excited about it, and it's been a 5-year journey, and it's coming together.
The spaces here are absolutely beautiful. I know the courtyard's going to be used for the symposium for
Yes.
HPA next year. Can you talk a little bit more about what services that HPA is going to be providing to St. Francis in this partnership as well?
Yeah, so when I was talking about the education piece, especially for the caregivers, our caregiver population, back in 2019, prior to COVID, we taught approximately 1,000 caregivers throughout the 12 months, the calendar year 2019. All kinds of subjects, from trust, wills, estate planning, to bathing services, to cooking demonstrations, dietary education, to how to take care of my loved ones my loved one that has Parkinson's. We would like subject matter experts like Jerry, like the Parkinsons Association, to use the facility and educate the caregiver groups that come in. So I see the Parkinsons Association being part of that education back to the community.
And having that new resource center located here, it's so convenient for
Perfect.
the whole. I know some parts of the village are already open and being used. What kind of feedback are you hearing from the community groups that have
I'm
access?
getting great feedback. Everybody's excited. They like how this is come to play. They like the fact that this is a place where seniors can come and enjoy. You're familiar you'll get familiar with the services, the clinical services, but to have the social services on campus. Some seniors aren't sick, but they're home alone. So is there enough social services here where their mindset, wellness is not just physical, it's up here too. So we got to create that environment, and I'm excited about it.
With Hawaii's silver tsunami, so many people in the senior citizen group in coming years, are there any other needs that we need to be aware of or that St. Francis is looking at?
I think it's all of those needs, and that's where we started with the silver tsunami. And as we started to embark on that and get the seniors coming in, I actually talked to a whole bunch of senior support groups, told them what we were doing, asked them if it was okay or am I missing anything, and that's when we discovered the caregiver groups. So that was, and I realized how stressful that is, and now we did a quick pivot, and we're trying to help as many caregivers as we can.
All right, Jerry Correa, CEO and President of St. Francis Healthcare System Hawaii. Thank you so much for all of your work. We really, really appreciate it. Mahalo.
Thank you.